Hello, everyone. Today I'm here to talk to you about if marijuana is a safe and effective alternative to anxiety and sleeping medication. So, why is this important? Many of these prescribed medicines have negative side effects. Many of these medicines are addictive, causing potential worse side effects. Many people abuse these drugs. Certain drugs may not work as well as marijuana could. Some examples of side effects of prescription drugs include constipation, nausea, feeling high, slowed breathing rate, drowsiness, and many more, which we'll get to later in the presentation. Learning objectives for this presentation, what I hope you guys will get out of this is some benefits of medical marijuana, side effects of certain prescribed medicines, and how to know if this could be a potential option for you. So, what is marijuana and where is it legal? As stated by the National Institute of Drug Abuse, marijuana refers to the dried leaves, flowers, stems, and seeds from the cannabis sativa or cannabis indica plant. This plant contains the mind-altering chemical THC and other similar compounds. Extracts can also be made from the cannabis plant. Marijuana is also one of the most used drugs in the United States amongst both adults and teenagers, as we have learned in our textbook. On this slide, I have a map of what states are legal and what states are not, and in between. So the orange is states that do not have programs for legal THC, and the dark green states are where recreational use is legal. I think it's crazy to see how, for example, Illinois and Indiana are complete polar ends of the spectrum and they're right next to each other. And I mean, I myself am from Indiana and I know plenty of people who daily or weekly drive to Illinois to get a supply, even though it's not legal in our state. There's just a lot of different ways to get around it, even though the laws are different in each state, which I find very interesting. So what is medical marijuana prescribed for? It can be used both recreationally and medicinally. It can be used to treat rare forms of epilepsy, nausea, and vomiting associated with cancer, chemotherapy, loss of appetite, and weight loss associated with HIV and AIDS, chronic pain, MS symptoms, and sleep problems. So, how is marijuana administered? It can be administered orally, sublingually, or topically. The most common orally way is smoking. Sublingually, eating and drinking. A lot of people will, cook down the marijuana into butter and put it in their food or put it in their tea. And topically, which can come in creams or in that form, and that's most seen, or I've at least most seen it and read about it in like CBD products to help with inflammation and stuff like that. So, what are the side effects of marijuana usage? The first is euphoria, which is a strong sense of happiness. Some might say that's a positive side effect. Altered senses, impaired memory and thinking, confusion, poor muscle coordination, relaxation and sleepiness, dizziness, panic attacks, which I find interesting because it can also be used to treat that, dry mouth, increased heart rate, increased appetite, as many of us might know would be called the munchies, slower reaction times, harmful interactions, and hallucinations, which I hadn't really heard of before doing this class with marijuana, but it is a real thing. It's not very common, but it can happen. Now I'm going to transition into what anxiety medications are. So the definition is a drug used to treat symptoms of anxiety such as feelings of fear, dread, uneasiness, and muscle tightness that may occur as a reaction to stress. Most anti-anxiety agents block the action of certain chemicals in the nervous system, also called, I cannot pronounce those words, agent. and list of common prescribed medicines. So these are the top 4 most common, but there are others. SSRIs, SNRIs, TCAs, and benzodiazepines. And then I gave some examples of SSRI, Celexa and Lexapro, SNRI, Cymbalta, TCA, Elavil and Palmalor, and benzodiazepines, Xanax and Valium, which I feel are the most well known. So there are a lot of side effects of anxiety and medication. Between all 4 of these, there's a lot of crossover and a lot of similar symptoms. I'll read the SSRIs, which is nausea, diarrhea, constipation, loss of appetite, blurry vision, dizziness, drowsiness or fatigue, dry mouth, feeling agitated or restless, headache, sexual difficulties and erectile dysfunction, and sleep problems. And the next 2 are pretty similar, and then benzodiazepines have a few more serious side effects, such as like overdose, addiction, seizures, and it can also increase anxiety and depression, which is very scary to think about since that's what it would be used to be treating for. So next, I'll be moving on to sleeping pills. So what are sleeping pills? Sleeping pills treat insomnia by making you feel drowsy and relaxed. Sleep aids, including natural ones like melatonin, can cause side effects. You may feel confused or sleepy during the day. Some people walk or eat in their sleep, which is parasomnia. Other non-drug therapies like cognitive behavioral therapy are better at improving sleep. And list of prescribed medicines, antidepressants, also benzodiazepines, and Z drugs such as Ambien and Lunesta. The side effects of sleeping pills are similar in a lot of ways to the side effects of anxiety medicine, constipation, diarrhea, dry mouth, headaches, muscle weakness, digestive problems, parasomnia, sleepwalking, and substance abuse are just some of those which we can see are similar in a lot of ways to the other medicines listed before. This graph shows us a study that was done in 2015 for the past year of misuse of prescription psychotherapeutics among people aged 12 or older. If you look at the graph here, you can see that any psychotherapeutic drug was the most misused in the age category of 18 to 25. And then you can also see some other drugs that are abused or have been. When looking at which prescription drugs could medical marijuana supplement the best, there was a lot of data to show that it could help with pain management instead of hydrocodone, oxycodone, or morphine. It can also be in place of anxiety medication or antidepressants, as we have talked about before, and I gave some examples of what those medicines would be. Not only can marijuana supplement certain prescription drugs, but it can also directly treat some diseases and other health conditions such as Parkinson's, Alzheimer's, anorexia, epilepsy, MS, Crohn's disease, and glaucoma. I find this to be really cool that people, and I've actually seen videos of people who had to move to Colorado whenever it was first legalized because they were having Parkinson's or epilepsy, and you can see their real life reactions to watching the drug work on their conditions, and it is a really cool thing to see. When asking yourself how do you know what is best for you, first look at the symptoms that marijuana can potentially treat and ask yourself if you fit in any of those categories. If so, definitely do further research than just this PowerPoint into the side effects of both medical marijuana and prescribed medications and see what you are most comfortable with. And before anything else, please consult with a doctor and see what their opinions are based on your health and symptoms. To summarize, there are many reasons why it is important to do research on drugs you're using and what the pros and cons of each are, it is never a bad thing to look into a potential, less intense alternative. The legalization of marijuana is still not federal, but state by state, marijuana can be used to treat many different medical conditions, as well as supplement certain prescribed medications. Sleeping and anxiety medications are some of the most common medicines marijuana is supplemented for. These prescribed medicines can have various dangerous side effects. Drug abuse is very common with many of these medicines. In conclusion, medical marijuana can potentially be a positive supplement to many alternative prescribed medications, but there is much more research that should be done before committing. Many prescriptions used to treat both anxiety and sleeping issues can have a lot of potential negative side effects, which may outweigh the positives in some perspectives. No matter what, if a person is thinking about trying any of these drugs, they need to consult with a doctor first to choose the safest option for them. I have 3 questions that you guys can think about. The first is, how can we promote medical marijuana as a positive alternative for many prescription drugs? Because I feel like although a lot of people know about it, they know all the negative connotations that come along with it and society's perspective instead of looking at the benefits that it can have on health. Was it surprising to see all the negative side effects of the prescription drugs? And do you think there are more Eastern medicine alternatives to other drugs out there? This is my reference page. Thank you guys, and I hope you have a great rest of your summer.